Hi everyone, welcome to Study for the NCE. Today we are going to be under clinical focus, sub heading letter T, which is obsessive thoughts slash behaviors. Now this has changed in recent times. The Diagnostic Statistical Manual of Mental Disorders, or DSM 5, which is the latest update, has taken obsessive compulsive and related disorders out of the category of anxiety disorders, which was under that category in the DSM 4. So that has been a big change for obsessive thoughts and behaviors, because before they used to be under the anxiety disorders, but now they are under their own category, um, of in the DSM 5. So with that change, it's important to understand that there are different types of obsessive compulsive related disorders. And I'll just mention some of them that are in the DSM 5. There's the obsessive compulsive disorder, or otherwise known as OCD, body dysmorphic disorder, or BDD, hoarding disorder, trichotillomania, excoriation disorder, which is skin picking, substance medication induced obsessive compulsive related disorders, obsessive compulsive and related disorders due to another medical condition, and then other specific OCD related disorders, and then unspecific OCD. So those are just some of the categories that are under the obsessive compulsive, which is no longer under the anxiety category in the DSM 5. It's also important to understand that obsessions are reoccurring and persistent thoughts, urges, and images that are experienced as intrusive and unwanted. So this is a thought that it's something that is continuously going like a broken record, and you do not want to think about it, but it's almost forced upon you. Whereas compulsions are repeated behaviors or mental acts that an individual feels driven to perform in response to an obsession or according to rules that must be applied rigidly. For example, if an individual is has an obsession with, let's say, bacterias and germs, then the compulsion would be having to wash their hands, or having to clean, or having to put on a mask, or having to do a lot of these rituals because of the obsession that they are feeling like, a germ might infect them, or something might happen that where they would get infected. Other obsessive compulsive and related disorders are characterized by preoccupation. So again, the constant thoughts, as well as the repetitive behaviors, and mental acts of those preoccupations are some of the characteristics of these behaviors. And then obsessive compulsion, it's also characterized by the repetitiveness of the behavior. So things like skin picking, or hair pulling, or washing hands, or biting nails. So the repeated attempts, the purpose of those is to stop the behaviors, but in doing so, it's a compulsion, it's a repetitiveness that really takes over someone's day-to-day living. So that's just a little bit about the compulsive behaviors, and also keep in mind that there has been a change between the DSM-4 and the DSM-5, and how the obsessive compulsive related disorders are no longer under the anxiety category.